Alright guys, let's get busy talking about testicular cancer. Testicular cancer is going to be something on your differential whenever you have a male presenting with a testicular mass or testicular pain. These are going to be more common in our younger male patients. However, they can affect males of any age. So let's go ahead and start by talking about the pathophysiology here. So in terms of the pathophysiology, this is a primary neoplasm of the testicular tissue. However, it is important to know that there are two different types of testicular tissue that can lead to cancer, and one is far more common than the other. So the most common, 95%, are going to arise from germ cell tissue, which are going to be the sperm cell progenitors, and then the other 5% are going to arise from sex cord stroma, which is going to be the Leydig and the Sertoli cells. And so if we zoom in here to take a little closer look at our testicular anatomy, you'll see that there's these tubular-like structures which are responsible for helping maturing sperm. And so these are the sperm progenitor cells, which I'm drawing here in these circles with a little dot. And then down here towards the end of the tubule, there's more mature sperm. And this is the journey that sperm take as they mature. And I'm going to highlight that these progenitor cells are these purple cells. And this is where the majority of testicular cancers are going to arise from. Now, in addition to these progenitor cells, we also have supporting cells. So along the tubules, we have these Sertoli cells, which I'm making with these rectangles here. And then we also have Leydig cells, which I'm denoting by these round bodies here within the stroma. And I'm going to highlight both of these cells in orange because these are stromal type cells that are going to be supporting maturing sperm. And these are going to be less common to turn into testicular cancer. So if we kind of zoom out here, we can appreciate that 5%, which I highlighted in orange, is due to the stromal tissue. And then the 95% is going to be due to the germ cell tissue. Now, talking about some etiology and some statistics with testicular cancer, it's going to be most commonly occurring in young males, and there's going to be three risk factors that are going to be important to know. The first is going to be cryptorchidism, and this is due to increased heat. So we know that testicular tissue does not like high temperatures, and so if we have a cryptorchid testis that's stuck in the retroperitoneal space or in the inguinal canal, we can expect increased heat, and this can lead to cancerous changes at a much more rapid rate than we would expect in a testicle that's nice and cool, hanging away from the body out in the scrotum. Additionally, patients with Klinefelter syndrome who have XXY genotype are more likely to get testicular cancer than those who have a normal XY genotype. And then finally, contralateral testicular cancer is a risk factor for developing another testicular cancer in the opposite testicle. Moving on, let's talk about some presentation of our testicular cancer. This is usually going to present as a vignette. It's going to be like a 25-year-old male presenting to family care clinic after he noticed a lump on his testicle. It may be painful, it may be not painful. He may also complain of some associated scrotal edema. And you're going to look at this and you're going to say, okay, I'm going to do a physical exam and see what we're dealing with here. So testicular mass plus or minus scrotal edema. And then there's an important physical exam test to do here. And this is going to be the translumination test. And we talked about the translumination test before in our video on testicular and scrotal fluid collections, but let's just go ahead and review it again. So here's my rudimentary drawing of a flashlight. And essentially you're going to shine a light into the scrotum, and then you're going to see if that light passes through whatever suspected mass you're shining it on. So in a testicular cancer, if we were to shine this light, it would not make it through the testicular cancer because testicular cancer is made up of really dense tissue, whereas something like a hydrocele or a spermatocele, which is a fluid collection within the scrotum, would allow light to shine all the way through. So I'm kind of making this longer beam that would go through a potential hydrocele that I'm kind of drawing here because this is just simple fluid, so light will go right through. So when the light goes all the way through, and this is most common in most of our fluid collections, we call this a positive translumination test. In the case of our testicular tumors, the light does not pass through. We call this a negative translumination test, and that's going to be something important for differentiating masses or collections within the scrotum or testicles. So moving on, let's talk about some lab abnormalities and histology. These are going to vary by the type of tumor that we're dealing with, and we will cover these more in the table coming up on the next few slides, so stay tuned for that. And then we talked about our negative translumination test already. So let's move on to talk a little bit about our management here. So management of testicular tumors is going to be radical orchiectomy, which is a really fancy word for complete removal of the testicle using surgery. We very rarely would ever get a testicular biopsy, and this is because there is a really big risk of seeding the testicular tumor to other parts of the body. So rather than do like a fine needle aspiration biopsy or something of the sort, they just take out the entire testicle and that's it. So any histological images you see of testicular cancer are going to be from testicles that were removed using radical orchiectomy, and that's important to know. So I just want to highlight here, biopsy is contraindicated due to the risk of spread. We will be looking at a lot of the histological images from our radical orchiectomies, and this will be important for diagnosing the type of cancer. So stay tuned for the next video and we'll go over all those details. Can't wait to see you guys in the next one. Bye!